This is Siobhan. How can I help you?
Quitline is always the first call of action.
This is Glenn speaking. How may I help you?
We're the specialists in smoking cessation.
This one, Carlos, ¿cómo puedo ayudarte?
Never used anything like the nicotine patch or gum before?
And I'm going to help you hopefully quit smoking.
What I like to do is I just write a script for them.
I try to listen to see what is it that they are looking for.
Quitline specialists are just phenomenal in reaching out to smokers. They're educated, they're trained, and their goal is really to assist smokers in their attempt to quit by not only educating them about the dangers of smoking, but also educating them on the benefits of quitting.
It's most effective, obviously, in the people that are ready to quit and need the help to quit. And that's part of the job that we assess at the clinic. That's there. We give the number out and we ask if they're willing to call. But it's also a nag that we can keep asking them to call. Like anything else, it's not necessarily going to work the first time. It may work the 10th time, the 15th time, the 20th time. But I did have a person the other day told me they quit smoking after calling Quitline.
So I think when they make that phone call, they're there. They're like, you know what, this is my last resort. Let's see if they can help. And they are pretty desperate at that point. And I do feel that the Quitline recognizes that. And so when that person calls, they do everything in their power to aid them in their attempt to quit.
Janelle is a woman in her mid-20s. She has a busy schedule of school and work. She turned to the Quitline after many unsuccessful tries on her own.
I had the number and kept saying, I gotta call, I gotta call, I gotta call. And then I was at work in the yard with the animals and just picked up my cell phone and called. Okay, this is it. We just gotta call, we gotta do this, we gotta get it done.
I am saying that the science to date and over $100 million of our industry.
The tobacco industry has never really owned up to the fact that their product is deadly.
I think that if the company as a whole believed that cigarettes were really harmful, we would not be in the business. We're a very moralistic company. You will discover there's a great deal of doubt with regard to whether or not smoking causes all these diseases which are alleged to be caused by smoking.
The risk increase for heart disease and lung cancer was on the...
As director of the New York State Smokers Quitline, Dr. Michael Cummings is well aware of how difficult it is to stop smoking.
Quitting smoking is a process. It's not a treatment and you're done with it. It's a day at a time for most smokers. Once you're an addict, you're always an addict, and you're choosing not to smoke each day. And we basically are there to provide support for both the people who've quit and are off, as well as the people who are struggling to get off the cigarette.
It's a pretty big deal because I knew that I was ready, and that's why I called. And it helped me to make it more concrete because, like I said, I made a promise to somebody else, not just myself. And I couldn't just walk around saying, I'm gonna quit, I'm gonna quit. I actually set a date and got the product, and it's like taking that next step, not just talking about it.
The message is quit smoking. In 2000, New York State established the Smokers Quitline. It's a one-on-one direct assist to any New Yorker who wants to quit. Skilled specialists employ a variety of tools to get callers to quit.
Most of the people who call us after the counseling will make a quit attempt. We find that about 80 to 90% are making a quit attempt within actually the period of time we actually try to get people to set a quit date. So within about 2 to 3 weeks, most people are making a quit attempt.
Nicotine is 10 times more addictive, ounce per ounce, than heroin. New York State Smokers Quitline makes me look really good. Having that resource available so that we can take community members and have right there instantly a number to call, then they can get the help they need from that Quitline instantly when the need is there.
Smoking, they call because they want to quit smoking. They're passionate about their decision to quit smoking. And we're not so much as friends, but more of a support system for them, which I guess a friend is, but we just are a support system and help them know that there is a way to do it, and we're going to help.
We also have programs for physicians and other healthcare providers where they can fax refer patients directly into our Quitline. That's a major source of how people get into our Quitline and learn about it is from healthcare providers.
When I counsel patients for smoking cessation, which I do on a regular basis, I always let them know about the help that's out there from the New York State Smokers Quitline. They just fill out this simple form, which is confidential information. Once the patient has signed the consent and given their permission for the Quitline to call, I fax the form right over to the Quitline, and the linkage is already made. They just say when they would like to be called, and that's the time then the people from the Quitline will call them and give them the help they need to help them so that they are able to stay quit.
It helps me feel like I'm doing a better job as a doctor. That's really the bottom line. It improves my quality of care because I really have not had the time. I may screen for it. And we do a good job screening for people. We have smoking as a vital sign. So when the nurses take the blood pressure and the pulse, they also ask if they smoke. And we know from the chart who smokes and who doesn't. But that doesn't mean that I necessarily deal with it each time or have the time to counsel people. So a lot of people I wasn't counseling, who I can now, just by writing the Quitline number on a script pad, I make it a prescription. I say, quit smoking, and I write the number and I give it to them. I also tell the Quitline, tell them I'm the one who called so that I can follow up and know if they followed up.
If you look at just smokers trying to do this on their own every year, if you track a group of smokers, we've done that as well, the quit rates are about 3 to 4% a year. So that's a significant increase. Of course, the people will call a Quitline or get fax referred to a Quitline are self-selected. They are different. They're probably more motivated to quit. We reinforce that motivation, and then we provide them, with some tools to deal with their nicotine dependence, and that's essentially the treatment, combining motivational counseling, with the, treatment of nicotine dependence.
Now, on a scale from 1 to 5, how confident are you that you won't be smoking a year from now? All right, that's okay. That's okay. This is what I do. I'm here to help people, and if I have not helped somebody, then my job is not done.
I just want you to know that these services are also in Spanish. By having a Spanish speaking on the other side, they feel that they are not lonely, that someone is listening to them. Gracias por llamar a la línea de ayuda para dejar de fumar. They would like not to feel that they are a number, rather that someone is understanding where they're coming from. Esta tarde vamos a estar hablando aquí, o esta noche vamos a estar hablando.
I like to change behavior, what I call the BPN, brief persistent nag. So I keep asking them, are you ready to quit? Are you ready to quit? Well, they know I'm going to ask. They can still say no. And at the point they're ready, I say, when you're ready, then I have this to help you. Before, it's when you're ready. I could write the nicotine, I could write the others, but I really couldn't monitor them well. And that's where the Quitline really helps.
Do whatever you have to do. And you only can do it one day at a time, so don't think about forever because you have no control over that. A lot of people are so afraid of quitting because they can't imagine spending the rest of their life without a cigarette. You can develop skills and strategies that are like a bag of tricks, and as long as you're familiar with them, when you need them, they're there, you just grab them.
You should be proud of yourself. You're doing a really good job. That's good.
A third of the patients in our cancer center here today are here because of smoking. Imagine a vaccine to prevent a third of all cancers. Well, we've got it. Don't smoke. Whatever it takes for people to be successful, we're here to help people in New York State who smoke to get off of this lousy habit and get a little freedom. That's why we call it NY Smoke Free, because that's what we want, every New Yorker to be free of tobacco.
If you have decided it is time to quit or you are thinking about it, help is a toll-free call away. Call 1-866-NY-QUITS. That's 1-866-697-8487. When you call us, you can hear the tip of the day that offers practical ways to help you quit, or you can leave your mailing information and we'll send you a packet of stop smoking information. And of course, you can speak with one of our Quitline specialists who will talk to you about your stop smoking process and see if you're eligible for a starter kit of free nicotine patches. Don't worry, all your information will be kept confidential. If you qualify for the patches, a Quitline specialist will call you back to see how you're doing, and be sure you've received the package we promised to send you. You can call us as many times as you need to ask a question or just to get you through a tough time. You might also want to visit our website at www.nysmokefree.com for more stop smoking information, materials, and helpful links. Or email us a question or comment. Please take advantage of the services that are there to help you quit and stay smoke-free for the rest of your life.